Hey, Tushy team. Today we're going to talk about prolapse. Prolapse. That is when a body organ is displaced from its normal position, usually in a down and outward manner, and out from an orifice or an opening. And because I'm a proctologist, a Tushy doc, we're going to stick with my area of expertise. We're going to talk about hemorrhoid prolapse and rectal prolapse. So hemorrhoids are venous cushions. If this is the anus and this is putting a finger inside, internally we have 3 of these balloons filled with blood, and they can actually come out and look like this and go back in. Now look very closely. You can see there's 3 individual hemorrhoids. There's lines between them. And when you look in the mirror, okay, or if you were to snap a picture of this, if this was happening, you would see 3 individual hemorrhoids coming out, which looks totally different from rectal prolapse, which when your rectum comes out of the anus. Well, I mean, it doesn't like fall out of the anus and you lose it. Part of the rectum comes out just like your hemorrhoids come out. So if this sock is the anus and the rectum, this is the anus and this is the rectum. And the rectum sits on your bone, your sacral bone, and it is taut. And the rectum, when it gets expanded, like my hand in here, it gets big, it squeezes in a hand-over-hand manner, and it pushes the stool out of the anus. And that's how the rectum works. So when the rectum is not taut anymore, usually due to delivery, women delivering children, or patients are very constipated and straining a lot, the rectum starts to move. And instead of being stuck to the wall, it starts to get a little bit scrunchy like this. And when it does that, eventually it'll boop, pop out. And now the rectum is outside the anus. So when you look, it looks like more like a rose. It doesn't smell like a rose, it looks like a rose. So this is what a rectal prolapse looks like. And this is what hemorrhoid prolapse looks like. And when the rectum comes out, patients will push and it'll go right back in to where it belongs. The difference between the two also is hemorrhoid prolapse I can treat without any pain in the office, and rectal prolapse requires surgery. So that's prolapse, Prolapse, when an organ is moved from its normal position, usually in a downward and outward fashion, out of an orifice. Thanks for letting me educate.